Good evening. I'm Amy Vickery, Stanislaus County's Public Information Officer, and this is your COVID-19 community update for June 12th. On Friday evenings, I like to review unanswered questions that have come in throughout the week just to keep the public informed. So here is your Facebook Friday update. First question is from Josh, and he says, I'm seeing way more negative tests than positives. What is this spike everyone is talking about? In our testing results, the percentage of COVID-19 positive test results are coming in higher than they have in the past couple of months. While our overall testing positivity rate is 6%, the positivity rate of our most recent 7 days is 10%. This speaks to our increase in total number of positive cases, thus the spike. This week we've actually seen two of our biggest increase positive test days since the beginning of the pandemic, with 52 positives that came in on Tuesday and 49 positives yesterday. Laura asked, could it be that more people are getting tested and that's why there are more positive tests? The answer is no. County testing has not significantly increased capacity or testing over the past month. Again, we're just seeing a lot more positives. Adrian says, so do we have adequate contact tracing so we can isolate the outbreaks? Yes, we actually have nearly 100 staff members doing contact tracing at this time. Many staff have actually been reassigned from other job duties. And now to clarify the what and why of contact tracing, this is done when public health departments call people who have tested positive for an infectious disease and find out where they've been so they can warn others who've been in close contact with those individuals to suggest that they get tested or isolate. It's used for many diseases such as STDs or even foodborne illnesses like salmonella. Contact tracers will never ask for information you should know, like social security numbers or bank account information, and they will provide a verifiable number to call back. Contact tracing plays a vital role in slowing the spread of disease, so if you should get a call, it's imperative that you answer the call or return the call and provide them with accurate information. On last night's Facebook post, we suggested that those who protested get tested. And Mike asked why we were allowing protests, riots, and looting. And there were other similar suggestions related to why we don't just stop protesters. So I want to mention that there is this assumption that we allowed or we permitted these protests, and that really isn't accurate. Protesting is a First Amendment right, and we do not, quote, allow them. But there was confusion because law enforcement has said that they were in support of peaceful demonstrations, and many of you saw that streets were closed for the protests. The streets were closed not because of permitted activity, like when they close streets for an event. The streets were closed for the purpose of security plans and protection of those who chose to demonstrate, and also to protect the businesses. We've also gotten a few direct messages asking about 12-step programs and when they can begin to meet again. And from what we understand, I want to announce that 12-step programs are essential. They've been deemed essential. And so anyone participating in these programs should feel free to attend them again. Finally, an appeal to the community. We've all watched our positive case counts rise over the last couple of months, and we now have well over 1,000 positive cases in our county. Some who have gotten really, really sick and been hospitalized, others who maybe just were tested because they knew someone who caught the virus, but they really were asymptomatic. The EOC would love to talk to people who have gotten the virus and interview you over video. So if you have had COVID-19, you can help prevent others from getting sick by sharing your story and your advice. So if you're willing to chat about your experience with our communication team, please let us know in a direct message or call 211 and leave your name and your phone number, and someone from our team will call you back. In the meantime, stay safe and stay healthy. Keep sending us your questions, and we'll see you next week.